Her leg.
We'll need an x-ray and an MRI.
Let's also get you something stronger than this ice pack for the pain.
No, they gave me Vicodin when I had my wisdom teeth pulled. I was sick for 2 days.
We have other painkillers.
Really? I'm fine. I made it through childbirth without drugs. I can make it through this.
That hurts less than childbirth.
There's traumatic avulsion of the ligaments. She's going to need surgery. We hammer a long rod through the medullary canal to hold the two ends of the break together.
It's a broken leg. Can't you just put a cast on it or something?
Obviously, you'll be asleep. You won't feel anything.
I lied about the Vicodin making me sick. My husband doesn't know. I'm an opioid addict. I've been clean for 10 years, but one dose can send me right back. Do whatever you need to do to fix my leg, but you can't use any narcotics.
Not even an epidural.
The strongest thing she'll let us give her is Tylenol.
Ketamine? What about ketamine? It's non-narcotic and can create a dissociative effect.
It's mind-altering and potentially addictive.
A different surgery. Some other way of putting her leg back together.
An external fixation. We put 2 pins through the proximal tibia, another 2 in the distal end of the bone beyond the fractures.
Healing will take much longer, and there's an increased risk of infection and permanent deformity.
And small pins are much less painful than a huge nail.
I'll get her prepped.
Take a few more of those deep breaths for us.
2 more to go.
P is 190 over 110.
Shot any beta blockers?
Wait, no!
No, they're not narcotics. We just need to give you something to reduce the pressure.
Back to 150 over 80.
Harry, how are we doing?
Better.
We'll get this last one in, and you'll be good to go.
Carrie's leg is swelling up. I think she has compartment syndrome.
We'll have to do the surgery we've been trying to avoid. We'll first have to make multiple incisions to relieve the pressure, and then replace the external frame with an internal nail. If we don't act soon, you could be facing an amputation.
Okay.
You'll need to be sedated.
No, look, I can take it.
Gary, you had a blood pressure spike during the fixation procedure. Without anesthesia, you could have a hypertensive crisis, a risk of stroke, or heart attack. Post-op, we can help you manage the dosing, and if you relapse, we have counselors that...
No, any amount of pain is better than losing everything again. My husband, my daughter.
If we can't convince her to change her mind, maybe her husband can.
We're not permitted to reveal any secrets to the husband, but we can tell him that there's been some complications. We need to perform an additional surgery.
What do you need to do?
I can't tell you. I'm unable to go into further detail. It would violate your wife's confidentiality.
Confidentiality? What's going on? Why can't the doctors talk to me? Obviously, there's something going on you don't want me to know. Are you dying?
No, there's nothing like that. I'm an opioid addict. I've been clean for a decade, but that's why I never take painkillers, and that's why I can't let them use anesthesia.
Why didn't you ever tell me?
If I relapse, I know I'll drive you away.
How could you ever think I'll stop loving you?
I love you, but I'm not as strong as you think I am. I just can't. I'm so sorry.
Are you ready?
She definitely is a Wonder Woman.